Systemic lupus, erythematosus, or SLE, is a chronic, complex autoimmune disorder in which the immune system mistakenly attacks the body's own tissues, causing widespread inflammation and damage to various organs and systems. It primarily affects the skin, joints, kidneys, heart, and other internal organs. SLE is a type of systemic autoimmune disease, meaning it can affect the whole body, including multiple organs and tissues. It affects about 1 in 2,000 people globally and is more common in women, especially those of childbearing age. It disproportionately affects certain ethnic groups, including African, Asian, and Hispanic populations. Genetic factors play a significant role. A family history of lupus or other autoimmune diseases increases the risk. Certain genetic markers are associated with a higher susceptibility to developing SLE. Environmental triggers such as infections like the Epstein-Barr virus, exposure to sunlight, smoking, and stress can trigger or exacerbate SLE in predisposed individuals. The disease is more common in women, particularly during their reproductive years, suggesting that hormones, especially estrogen, may play a role in its development. In SLE, the body's immune system becomes overactive and produces autoantibodies, antibodies that attack the body's own cells and tissues. These autoantibodies can form complexes with self-antigens, which deposit in tissues and lead to inflammation and damage, particularly in organs like the kidneys, skin, and joints. Chronic inflammation due to the immune system's attack leads to tissue injury, often resulting in long-term damage if not treated effectively. The symptoms of SLE can vary greatly depending on which organs are affected. Some common manifestations include fatigue, which is a common and debilitating symptom. Musculoskeletal issues like joint pain, swelling, and muscle pain are also frequent. The skin can show the characteristic butterfly-shaped rash across the cheeks and nose, photosensitivity, and discoid lupus, which are scarring lesions. Kidney involvement can lead to inflammation of the kidneys, known as lupus nephritis, resulting in protein or blood in the urine. Neurological symptoms can include seizures, cognitive dysfunction, and psychiatric manifestations. Cardiopulmonary symptoms may involve pleuritis, pericarditis, and an increased risk of heart disease. Clinical diagnosis is based on clinical presentation and the signs and symptoms observed. Now let's talk about some key laboratory tests. The anti-nuclear antibody, or ANA test, is a crucial diagnostic tool. It's positive in almost all SLE patients. Then we have anti-dsDNA antibodies. These antibodies are highly specific for SLE and can indicate disease activity, especially when the kidneys are involved. Complement levels, specifically low levels of C3 and C4, are often seen in active SLE cases. Finally, urinalysis is important. Protein or blood in the urine can suggest kidney involvement. When it comes to cutaneous manifestations, the butterfly rash on the face is one of the hallmark signs of SLE. Other skin changes, like discoid lesions, may also occur. In terms of musculoskeletal issues, joint inflammation, stiffness, and pain are common though. Thankfully, they often don't lead to permanent joint damage. Renal complications are serious. Lupus nephritis, for example, requires careful management to prevent kidney failure. Neurologically, lupus can affect the central nervous system, leading to seizures, strokes, and psychiatric disorders. And let's not forget the cardiac implications. SLE increases the risk of cardiovascular diseases, including pericarditis and atherosclerosis. There is currently no cure for SLE, but treatment focuses on managing symptoms, preventing flare-ups, and minimizing organ damage. Non-steroidal anti-inflammatory drugs, or NSAIDs, are used for joint pain and inflammation. Corticosteroids like prednisone are often used to control inflammation during disease flare-ups. Immunosuppressive drugs such as methotrexate, azathioprine, and cyclophosphamide are used to suppress the immune system in severe cases or when organs are involved. Hydroxychloroquine is commonly used to manage skin and joint symptoms and to reduce the risk of flares. Biologics like Sun protection. Use of sunscreen and protective clothing to prevent rashes triggered by sunlight. Exercise and diet. Regular physical activity and a healthy, balanced diet are important for overall health. Stress management. Emotional stress can trigger disease flares, so stress reduction techniques like meditation or therapy may be helpful. With treatment. Most people with SLE can live a normal life expectancy with proper management. Early diagnosis and ongoing treatment are key. Disease flares. SLE is marked by periods of exacerbation or flares and periods of remission. Flare-ups can vary in severity and affect different organs. Complications. If not well controlled, SLE can lead to permanent damage to organs, particularly the kidneys, heart and lungs. Individual variability. The disease varies greatly between individuals, making it challenging to predict and manage. Medication side effects. Long-term use of immunosuppressive drugs and steroids can lead to side effects, including osteoporosis, weight gain, and increased risk of infections. Psychosocial impact. Chronic illness and frequent hospital visits can have a significant emotional and psychological impact on patients. Systemic lupus erythematosus is a chronic autoimmune disorder that can affect many organs and systems. While the disease can be difficult to manage due to its complexity and variability, advances in treatment and early diagnosis have significantly improved the quality of life and prognosis for many people with SLE. A comprehensive approach involving medication, lifestyle adjustments, and regular monitoring is essential to managing the disease and preventing complications.